Well, hello everyone. I'm sure many of you know me, but if you don't, I am Martell Teasley, Dean of the University of Utah College of Social Work. It is my pleasure to welcome you to the first presentation in the 2021-2022 Talks with Teasley series. Before we get started, on behalf of the College of Social Work, I'm proud to recognize the contributions of our American Indian community members by acknowledging that this land, which is named for the Ute tribe, is the traditional ancestral homeland of the Shoshone, the Paiute, the Gochi, and Ute tribes. The University of Utah recognizes and respects the enduring relationship that exists between many indigenous people and their traditional homelands. We respect the sovereign relationship between tribes, states, and the federal government, and we affirm the University of Utah's commitment to a partnership with Native nations and University Indian communities through research, education, and community outreach. In addition, we pledge to engage in anti-racist practices here in the College of Social Work through our research, educational programming, and community outreach. Having said that, I want to thank you all for joining us live today, both in person and virtually, and to those watching the recorded version in coming weeks. Of course, we're not here live, we are virtual in general. We appreciate your patience with us as we navigate the new world of hybrid events and welcome your gentle feedback on how we may be able to improve our future hybrid events. Additionally, thanks to those of you who attended our events and supported the college through the last year and a half. We appreciate that you have stuck with us and that you have expanded our reach by sharing our webinars with former classmates and current colleagues. I am proud to continue offering free CEUs for our events throughout this academic year. I invite you to continue to join us for Talks with Teasley and the Grand Challenges for Social Work series speaking that includes our October 19th Grand Challenges event regarding gender-based violence and our October 28th Talk with Teasley event featuring Dr. David Darasotis. Detail of upcoming events will be available on our events page. I also invite you to join me and my College of Law colleague, Dr. Elizabeth Plunk-Warner, this Thursday at noon for our first critical race theory discussion of 2021-22 for the 2021-22 academic year. Today, we're excited to showcase Professor Stephanie Banks, the first of many talented College of Social Work faculty members working on an important topic for social work, health professionals, and the general community. This presentation on clinical tools for the future of telehealth touches on the complicated nuances of telehealth that are not as prevalent in face-to-face therapy settings, and the considerations, both ethical and clinical, that must be understood when providing telehealth care. It is my great pleasure to introduce Professor Banks. Since 2003, Professor Banks has worked in private practice as a licensed clinical social worker, focusing on a number of areas, including depression, grief, anxiety, relationship issues, and parenting. Professor Banks joined the College of Social Work in 2015 as an adjunct professor. Over the years, she discovered she enjoyed teaching, and we learned how good she was at it. So we hired her in August of 2020 as a career line faculty member. Along with teaching in the BSW and MSW programs, we are very grateful that Stephanie is now spearheading the telehealth curriculum for our School of Social Work. Her online experience expertise is a great asset to the BSW and the MSW programs as well, and we plan to use her skills broadly in that respect. Stephanie, you emailed me recently, and I'll get back with you on that, but I certainly talked to the online program director today, and we welcome using your expertise as we venture and strengthen that program. Through her experiences as a clinician, Stephanie learned that telehealth is a very useful tool to support client needs and quickly became a strong advocate for the use of telehealth. Telehealth has opened doors for work with a broad range of treatment issues and allows Professor Banks to utilize different theoretical models and even EMDR with clients while online. She is interested in telehealth work and the importance of setting boundaries and understanding the ethics and best practices for this sort of healthcare. Professor Banks appreciates that telehealth is a wonderful tool and truly enjoys helping others learn how to use it as well. Before I turn the time over to Professor Banks to advocate to advance her knowledge of this increasingly important treatment option, I want to thank you again for joining us today. We hope this presentation and our future events, along with their associated CEU opportunities, will serve you well. Take care. Stephanie, I'll turn it over to you at this point.
All right. Thank you very much, Martel. I'm assuming everyone can hear me. I can't see faces, but Martel, are we good? Can you hear?
Yes, good.
Okay, perfect. So I am going to share my screen and start our presentation. So, give me 1 second. We couldn't get this set up ahead of time, so we are doing it now. It's a good example of going with it as we go. Let me just stop sharing for 1 second and get this back down. All right. We should be good to go. So if Emily, if you'll let me know if there are any kind of technical issues on your end. Otherwise,
Yep, great.
Okay, perfect. Thank you. So today we are going to be talking about telehealth, the research about it, the best practices, outcomes, theory, all of those kind of things. So we're just going to jump in and get started. Hopefully you all have lunch and you can sit back and listen and have a bite with some colleagues maybe and hopefully learn a few new things. You know, our life is now divided into before and after COVID. So before March 2020, many people were really hesitant about going online, and rightly so. Clients were worried about whether they connect with their therapists. Therapists were worried about whether they could connect with their clients. Many therapists worried about client safety. How am I going to build a relationship? How do I stay HIPAA compliant? Am I going to be able to be reimbursed? How do we maintain confidentiality? Then COVID hit and we all jumped online. We didn't get a chance to even ask these questions. We just had to do it. We were in crisis mode. Clients wanted to see their therapists. Therapists wanted to see their clients. So we were all scrambling to get online, figure out platforms. Some social workers had never done a telehealth session before, really had to figure out the technology very quickly. Then all of a sudden, people were online, individuals, families, couples, group therapy. Here we are trying to figure this out together. So this is just an example I wanted to show you from the COVID study that was done regarding telehealth. So as you can see here, this, I'm not sure how clear it is on your end, but January 2019, these are all the different things that people were seeing telehealth for. Mental health issues, physical health issues, respiratory, blood pressures, you know, all of those kind of things. These were telehealth visits. We can see this huge spike here on claims of when the pandemic started, but this big one right here, that is behavioral health. So behavioral health took a huge spike in terms of insurance claims, and it's dipped, but it's also gone back up, and telehealth is here to stay. The COVID-19 telehealth study also found some really interesting facts about barriers to care. Many clients and patients reported that transportation was no longer an issue. Expense was no longer an issue of gas. Some clients have to choose where they take their car in order to utilize gas in the best possible way. So we wanted to make sure, telehealth is helping people. They're also not taking off time work. I've worked with many clients that they just, like this webinar is something that they do during their lunch break. They don't have to come in early. They don't have to leave late another day. They're not spending time and money in order to get treatment in the way that they potentially did before. This also shows the quality of visits. And again, this is medical and mental health, but the last one is the one that I wanted to go over, is that 83% report good overall visit quality. And I think that's pretty impressive. It's comparable or better than face-to-face, that people feel heard, they feel understood, they feel that their provider is listening to them and paying attention. So telehealth isn't going anywhere, and we need to make sure that we step up our game and really know what we're doing to make sure clients feel connected. There's been a lot of research about telehealth, and we're learning that it works. This quote comes from David Moore, who has been studying telehealth his whole career. So this isn't just in the last 18 months. This is something over decades have been studying, that what we've seen is telehealth is essentially just as effective as face-to-face psychotherapy, and retention rates are higher. The other thing is no-show rates are much lower. If a client forgot about an appointment and we send an email, hey, are you planning on coming today? They can just jump right online and we can meet them. They don't have to worry about getting in the car, racing. By the time they get there, they've missed their appointment. So no-show fees are significantly lower. No-shows in general are significantly lower. So the research is telling us that it works. Face-to-face and online have very similar outcomes, which I think is really good news and really encouraging. But we need to talk about what to consider before a telehealth session. So March 2020, we just jumped online and there we were. So now we need to take a step back and really look about what we need to do before going online. Informed consent is something that we've done with our clients since the beginning of seeing clients. So this is a form that you can find on NASW. They have a PDF as an example. You might also find something through your malpractice insurance. There are a lot of different examples online. But this goes through all the different criteria of what you're going to be dealing with when you're online together. You are going to be talking about what happens when there's technical issues, if there are emergency issues, what is the cancellation policy, if it's within 24 hours, or would you jump online if it's a transportation issue? These are the things that you would need to really figure out to make sure you've talked about before with your client before it starts. Another really important piece of this on the on the informed consent is emergency planning. So on the form, there's a section to do, where you are, your phone number and address. But one thing clients are loving about telehealth is they can go anywhere. I've had clients at work, I've had them in the car, I've had them at the park, I've had them at their parents' house, their partner's house sitting. So they could be at a different location every time. We need to make sure we have that information every time we meet with a client. I've had them, just tell me where they are. I had an adolescent send me like a ping location before. You can use the chat feature and just have them type in their address of where they are. The odds are we'll never, ever, ever going to need it, but it is something important that we need to have just in case. Very rarely do emergencies come up. It's the same as face-to-face. I'm sure some of us have had to call 911 for a client in our office, but probably not most of us. But it is something that we need to be prepared for in the just in case. I'm sure you've all seen all the kind of unfortunate and awful things people have witnessed on Zoom. Medical emergencies, mental health emergencies, intimate partner violence, gun violence. If something is happening on Zoom that we are witnessing, we need to know where to send help, because we cannot get help to them if they're not in a state to tell us where they are. If they're having a heart attack and they need 911 and we don't know where to send them, it's a place that none of us want to be. So it is something that we need to have with us every time, every client, to make sure where we know where to find somebody. The other thing is important to discuss ahead of time are technology issues. Even just me starting this, it took me a minute to get going. And I think we all understand that there are times that technology is going to work against us. As wonderful as it is, there are going to be times where it's hard. Do you have poor internet connection? What do you do? How do you problem solve that? Can you just go to an audio phone call? The other thing you'll need to know is, will insurance cover that? So will your insurance allow them to bill for a voice call if it's not video? Is that still considered telehealth? I've had lots of clients that their phone dies. I had a client the other day that she was outside and her phone got too hot in the sun and automatically shut off. Those things don't just automatically come back up when they're plugged in. It takes a good 5 minutes before we are, connected again and have contact. So it's one of those things that we need to make sure we have a plan. How do we connect with each other if it's the last 5 minutes? These are the kind of the nuances that we want to talk about before. Sometimes there's camera issues that a client may not be able to turn their camera on, or it's impacting their internet. So at that point, do you leave your camera on? Do you have your camera off? What would the client prefer? I would always recommend having cameras on as much as possible because it's such an easier way to connect. But sometimes that's not an option. So to try to problem solve these things ahead of time. And then also really assessing if your client has access to technology. We can't assume that everyone has it. I think we all think it's a right versus a privilege, and it should be accessible to everyone, but it's not right now. Some people don't have access. Some people don't have, strong enough internet. Some people have, a computer that's broken and they don't have the means to get it repaired. So we need to be very thoughtful and make sure we are asking whether or not telehealth is an option for them. Another thing we really need to think about is confidentiality in the environment for both the client and the clinician. And, before 2020, I think this would have been like, yeah, duh, no brainer. But when we were all forced home, that means our spouses, our partners, our children, grandma, whoever lived in that home were home. So working from home was everybody working from home. And that really changed things. So we need to be very thoughtful that we are in a professional, confidential environment in our home. Our family needs to know, or whoever we're living with, roommates, whatever, that this is a confidential environment and that you are not to be interrupted. You maybe kind of figure out with your family, like what would constitute an emergency. And that may feel very different to a 6-year-old versus, a 16-year-old. But these are conversations to have with people ahead of time, that if you are going to be seeing clients online, that you have a private protected space. I always recommend headphones for both yourself as well as your client. So there's at least half the conversation is private if somebody's around on the client's end. I had a client once that her grandmother was always sleeping behind her in a chair. And I would ask her questions. She had her headphones on. And if she didn't want to answer it, she'd go into the chat and answer it that way. And then, we could talk about it. And it was almost like a code we figured out how to use for her to have her own confidentiality, but we had to work it around it a bit. Again, this seems like a no-brainer, but we've all seen it happen, of being in a professional, confidential environment. That means you're not at a coffee shop. I don't care how quiet it is. We're in a public space seeing clients, never in your bed. We still need to maintain being professional. We might have to help problem solve, being confidential with our clients. I've had to do that with, a few different cases that they just didn't feel as free to talk as they wanted to be because somebody was around. So like the example of the client I gave you with the headphones, we problem solved that. I had another client who her kids were just always finding her, and she just wanted some private space to talk. It wasn't, if they heard, but it was much more she wanted that time. So she would go into her bedroom, close the door, go into her bathroom, which also had her closet. So closed her bedroom door, bathroom door, closet door. And it almost just became kind of almost a sacred space for her. She got a comfy chair, and it was something that this was her therapy time and her downtime, and she felt safe and comfortable, and it was something that we problem solved together. The other thing, especially on Zoom, we can set it up to record automatically. So if that's a setting, I would always recommend you taking that off. But it tells you when things are being recorded, but it's just something we need to be very thoughtful about and take the extra step to make sure that we are really respecting our clients' privacy. So COVID-19, the emergency status for most things is over, but as we all know, the pandemic is not. Rules are changing, statutes, there's a lot in flux. So we need to be very careful and very thoughtful and very thorough, making sure that we are following all of those expectations and rules. The responsibility of that lies on us. It is our job to make sure we know the statutes, laws, rules. We can't say, oh, I didn't know. That ignorance isn't going to be a pass for this. This is something we need to keep up on. So before COVID-19, again, we're talking before and after, there's a cute little dinosaur just minding his own business, and a giant COVID asteroid is coming to him while he's blissfully unaware. I feel like that represented me so much thinking back to 2020. But we were just HIPAA compliant. We followed the federal and state statutes. That just is how it was, and we just did it. Licensure, in order to meet with clients across state lines, for social workers, psychology has a different thing set up where there's different packs with different states. But as a social worker, we have to be licensed where we are. Like right now, I'm in Utah. I need to be licensed in Utah. And I also need to be licensed where the client is. If I'm seeing a client in California, I need to be licensed in California as well as in Utah. If I'm going to spend my winters in Hawaii, may that ever happen, I would need to be licensed in Hawaii and then also wherever my clients are. So licensure has to happen in both places. So this was pre-pandemic, and these were the rules and we followed them. Then the emergency status hit and things changed. So the ORC, the Office of Civil Rights, stopped imposing penalties for HIPAA. Things like FaceTime were allowed. Apple will not sign a business agreement in order to be HIPAA compliant. Their software is, with the exception of that paperwork that they refused to sign. So it's not HIPAA compliant. But during this time, we could use FaceTime. Licensure wasn't an issue. Some people were just locked down, and they were with their family in South Dakota. And instead of saying we need to go get licensed there, it was, we understand we are in crisis mode. So there was a much more lenient, expectation of that. That is very different now. And a lot of states are going back to pre-pandemic rules and regulations. So we need to make sure we check in our local states and any states that we may be seeing clients. It's really important that we do both. So as I stated too, the rules and regulations are constantly changing. Before we see a client, it is really important that we check with an insurance company. I would always recommend doing it yourself if a client, if you know their insurance, if they sign a release, and you're welcome to call the insurance company. But we need to know if they'll pay for telehealth. We need to know what they pay for audio calls. Would they pay for any diagnosis? Do they have to meet in person a certain amount of times? Are there any guidelines that we need to know about reimbursement? Utah has changed and increased their telehealth plans, which is wonderful and great, but that doesn't apply for everyone. When we're looking on the macro level of social work, a lot of people have access to telehealth, which is wonderful, but on a micro level, we don't know what each individual client's plans have. And so in order to be reimbursed, we need to check before to make sure that this is something that will be reimbursed. And we also need to check with licensing departments, as I said. So now we are ready to see clients. We know the research that it works, that there is evidence, excuse me, The evidence says that it worked equally well face-to-face as well as telehealth. So the question is, how do we connect with our clients? What do we do? So we know it works, and we know that there's often reimbursement. What's next? So when we talk about characteristics of an effective therapist, there are a couple points that I want to go over. And I think this is something that most therapists worry about the most. Our the theories that they're using in order to help with clients, as well as the connection. I think both things are really important, and we want to make sure we are meeting both of those things. And I'm going to start with theory. So I think there's a notion that you can only do CBT, solution-focused therapy, online, and that is absolutely not the case. All the research is showing that there is equal effectiveness for all sorts of different therapies, theories, populations. So the first one I wanted to talk about was EMDR. The research says it's just as effective working with a client face-to-face as it is online. And I've had a lot of people say, really? I mean, is that really the case? But it is. And then the research has been showing this for a long time. We have to adjust. We can't, do it the same necessarily as we would in our office, but we need to, problem solve that with our clients. There are things that you can look at the ceiling and find two places on the wall. There are light bars. There are all sorts of apps and programming to make sure that you have like a light that goes across the screen. I mean, the technology out there is really amazing. So that is just as effective online as face-to-face. Couples therapy, overall, the research is finding that the experience to be very positive, engaging. One thing that I found really fascinating about this is that a lot of couples found it even more helpful because it almost felt like a business meeting as opposed to an emotional meeting. So clients would get in, work on their stuff, find what they needed to do, as opposed to really getting stuck in the emotion of it and bickering and arguing. So there was a lot of research that it actually helped clients as opposed to, the computer getting in the way. And then finally, children and adolescents, we've found that they're very comparable in terms of face-to-face and online. Most children and adolescents are pretty comfortable with technology anyway. So that's a good start. I think we've all seen, a 2-year-old be able to take a selfie and post it on Instagram and not even, know what they're doing. But on some levels, it's all they've ever known. So they're actually very comfortable with it. They are stating as well in the research that adolescents are really liking the confidentiality piece of it. They're worried like they could see someone they know in the waiting room. And even though that person they know is in the waiting room too, there's still this sense of embarrassment of what if somebody knows I'm here. I've also worked with a lot of clients online, and they love to show me their world. And it's such a different thing of like, this is the art I was telling you about that I made that's on my wall. This is my dog who's so special to me. And we've talked about, him before, and really inviting me into their world. So as much as we can see barriers with thinking about telehealth, in reality, they're not really there. So we need to be comfortable embracing it, jumping in, and knowing that it really does work. So that's the theory piece. The next one is we all know how important the Therapeutic Alliance is, regardless of modality. I think it's something we learned early on in our careers that if all else fails, go to the relationship. A lot of social workers before March 2020 really worried, how can I connect with somebody through a screen? I think we're seeing that it's not as complicated as we thought, but we still need to be very thoughtful and intentional about our work. So nuances and distractions. When we think about comparing being in our office with somebody as opposed to being online, there's a lot of different things that we do to show that we're being attentive. For me, a lot of this boils down to just being respectful and demonstrating that with our clients. So we need to be attentive, we need to be focused, we need to be mindful, we need to demonstrate that we are listening. We need to do our best for placement, that we have eye contact as much as we possibly can. So we just need to be there and present and focused. And I know that sounds so simplistic, but it is something that is vital. The nuances of seeing somebody face to face this closely, it's easy to see, if something happens. The other day I was with a client and I just briefly looked at the corner to see what time it was. And she said, "Oh, I know, we're almost out of time." And I didn't want that message to be to her. I wanted to make sure I was monitoring the time, but I didn't want her to feel rushed or kicked out of the screen. So we need to be very thoughtful about our attentiveness. Professionalism. I always recommend that people dress as if they were going to the office. I think there have been a lot of jokes and things about no one's ever going to wear pants again, and we just dress nice from the top up, but we never know what's going to happen. You spill a cup of coffee on your lap and you jump up really quickly. We don't want you embarrassed. We don't want our clients embarrassed. We want to make sure that whatever happens, we are in a professional environment and we look professional. Pets, we all love our pets. We need to, it's been one of the highlights of being home for a lot of people, is to have their dog at their feet or their cats around. But a therapy session is not a time for our pets. We need to make sure they are off screen to the best of our abilities. We need to do what we can to control dogs barking, cats crying. I actually have a cat that when I first started online, he decided it was time to cry. And I let a client know, I said, I'm sorry if you're hearing that. That's my cat crying for no reason. She said, "I know it's been a while since we've seen each other, but I thought you had a baby." Like I thought, oh, wow, she had a baby since I last saw her. So it's important, to do our best that they're not part of it. Unless they're therapy animals. If there's somebody that they would be in the session with you, that is a different story. But it's not time to, give our attention to our pets. Communicating with our clients, everything that we're doing while we're doing it is very important, because again, they can't see what we're doing. So if I'm going to grab a pen, I let my clients know, say, "Oh, I'm grabbing a pen just to write some notes," or "I'm going to jot this down," or, the next thing says to make sure your notifications off. If I forgot to turn them off, to say, I'm gonna go do that now. So if you see me clicking around, I'm turning off my notifications, or my Bluetooth being wonky, I'm going to turn that off and fix it. When we can communicate that to our clients, they know what's going on, and they know that they have your attention. Cell phones, we also need to have those put away. Unless you use it clinically for something, it needs to be out of sight. For this presentation, I put my phone away, I put my Apple Watch away, and just make sure that I am focused and nothing else is distracting me. Because as much as we like to think we can multitask, we can't. When a notification pops up and it's a loved one or an awful news alert, it's going to grab our attention and we're going to be reading it even though we don't want to be. So the less we can do to have distractions, the better. I just out of sight, out of mind, as if you were in an office. Backgrounds. I find this one kind of interesting because there are a lot of different opinions about this, but I think it's one of those things that we need to just be as professional as possible. The green screens can get kind of tricky. I found that the blurring the background is better than trying to do kind of a fake background when we're looking at clients. It just can get distracting. So to be very thoughtful on if you choose to have a background, what that looks like and how it appears to clients, and practice kind of moving in and out of the screen and what that looks like. I personally don't use backgrounds. I've set up my background behind me in my home office in a way that I'm very comfortable with clients seeing. But I would be very thoughtful of studying your background, Make sure, look at your book titles, look at your pictures. Your clients will study it, so you need to make sure that you have looked at it as well. The other thing is when clients are on their phones, the vertical view is very different than the horizontal view of what they can see behind you. I had a client the other day just move her phone and she said, "Oh, I didn't realize you had a bunch of bookcases behind you. I thought you just had the one." So when they changed their view, it opened up the camera of what they could see behind me. So if I would have just shoved everything on that side thinking, no one could see it, they could have potentially seen that. So these are things that you'll want to practice and try to figure out before you do it. Another thing you want to keep in mind is your desktop. If you are sharing your screen, you want to make sure that, a lot of people have pictures on their desktop, to make sure it's an appropriate picture that you wouldn't mind seeing, making sure there's nothing private or too personal that would be on your screen, and definitely nothing confidential. So we need to make sure that, we're not working on the notes from our previous client and we're sharing screens and there's all that information. So we need to be really diligent about what's on our screen to the best of our abilities. And then I also say here is that we can't control everything. I mean, life happens, as we all know, and it gets into the way. But that's where the communicating with our clients is really important. Like the cat example of saying, "Sorry if you can hear that," or there's you might have heard that big noise in the other room. My dog knocked over a plant, and so I'm sorry if you could hear that, or those kind of things. So we just need to communicate with our clients so they know that we're focused, we're there, and we're paying attention. The other thing I always recommend is to embrace technology. We're here, might as well enjoy it. So to share screen, we can present a lot of psychoeducational material. This can be done with somebody of any age, that it doesn't matter. It doesn't have to just be kids. There are a lot of ways to watch short videos. They have great little cartoons discussing trauma, like what trauma does to our body and how that works, and really wonderful couple-minute videos, instructional videos. There are little clips from movies like Inside Out that you can watch about feelings and talk to kids about it. There are many, many free online sites that have interactive games that you can play together. So if you work with kids and let's say you play Connect 4 in the office together, you can do that online and be interactive, and they take a turn and you take a turn. Some of these sites are paid for, but a lot of them are free. And so there's a lot of way to be very interactive with our clients and make sure that it's still fun for them. The other thing I utilize a lot is the whiteboard, especially using on Zoom. So that is something that you can use with clients. I just did a quick example. I took a screenshot. I pulled up my whiteboard on Zoom and just did a screenshot. So things like you can play tic-tac-toe, you can play Pictionary. How are you feeling today? There's just a face that they can draw and fill that in. The dots and boxes game, I used hearts because they have little stamps that I could just, have even sizes of those. You could have them doodle while you talk. You can have them write. Lots of people need something to do with their hands. So it's a good tool to utilize when you are online. So it's getting creative, and it's also really important to just practice the technology and go with it. And I think there's a lot of understanding that people have these days that we're all doing our best kind of fumbling through this. The other thing is to remember that it's a different environment and we need to be extra thoughtful. So this example came from an online forum that somebody wrote that was it was anonymous. But they were talking about their experience as being in online therapy and being a client. So they stated that during the pandemic, we were obviously meeting via Zoom. She thought the call had ended, and I heard her say, "Jesus Christ, she's exhausting." I immediately texted her to call her out. She started and stopped typing a few times before asking to speak with me after she finished with the rest of her appointments. I had really liked her, so I was torn. I told her I would reach out when I was ready, but I was unable to get past it. My therapy came to an abrupt end. And I think that is an important example because personally, I have a lot of empathy for both sides of that equation. That must have been awful for that client to hear and devastating, and would cause a huge rupture in the relationship. And depending how far they were in their relationship, is that something that could be repaired? Obviously, in this case, not. So I have a lot of empathy for that client. I also have a lot of empathy for the clinician, that I think sometimes we just are tired. Things come out of our mouths. I'm sure she was exhausted, maybe not necessarily at the client, but the situation, or really wanting her to do well, and really, wanting to advocate for her, and she wasn't working in her own best interests. But something like this, I think we'd all be mortified, and we need to do our very best to make sure that we are just thoughtful, we are aware of our surroundings, and that we make sure cameras off, mics off, all of those things before, we even speak. It's one of those things too that I'll call out to somebody in my house, and those are things that we need to make sure that we are completely closed off from our work before we do that kind of stuff. So the next piece I want to talk about, and I think this is something a lot of people are really experiencing these days, is Zoom fatigue. I think we are worn out, we're exhausted, but I think we also find a lot of value in it as well. For example, this meeting was supposed to be potentially online as well as remote, and only a few people signed up for the in-person, so we did it remotely. I think it's a time saver for a lot of people. Like I said, hopefully you're having a nice lunch and learning a few things. There are a lot of really wonderful things to having Zoom meetings, and hopefully it's giving Mother Earth a little break with pollution and all of those things, but it's also exhausting. So one thing we need to think about is our self-care. NASW has just added self-care to the code of ethics. So it's something that professionally we're obligated to do, and to make sure that we are keeping up on taking care of ourselves. And this is more than just taking a bath and feeling relaxed at the end of the day. We need to say no to things when we're feeling overwhelmed. We need to say yes to things we really want to do. We need to make sure our boundaries are good. We need to really make sure we take care of ourselves. Another thing we need to do is find the right view, depending on the platform that you're using. I read an article about Zoom fatigue that said being on Zoom all the time is like walking around having conversations with somebody holding a mirror up to our faces. And that's exhausting for all of us. We aren't intended as human creatures to be interacting with people that way. So if you are on speaker view, your client is big and then you're little. And so you can still tell if you're on screen. You can make sure that you're not just like an eyeball, but you're also not needing to pay attention to yourself in the same way. Some platforms have the option of taking out your view, that you are seen by the client, but you don't see yourself. And again, as long as you know that your placement is good and you talk to your client and let them know, hey, my camera is on, but it's off my screen. So if something is wonky, please let me know. Otherwise, I'll just assume it's okay. Take breaks as much as you can. I think there's many of us who have had clients 8 in a row, back to back to back to back. And in the office, that was exhausting. On Zoom, it's nearly impossible. So it's something that I want you to be very thoughtful about, of taking breaks, taking care of yourself, getting up, moving your body, being comfortable. I just gave the whole speech about being professional, but these two can coexist. So I think it's very important that you are comfortable, that you have a good chair, that you have good support, that you have good headphones, that you don't have earbuds that are hurting your ears, and by the end of the day, you're in pain, that you have a good computer system, that you are able to, your station works really well for yourself. So to make sure that you're as comfortable as you can be. The other thing is, I think it's really important to have good internet, because it's always stressful when the internet is wonky. Is it me or is it you? What's going on here? So if you know your internet is good, it takes that out of the equation. So if you can Ethernet into the box, that's always the best. It gives us the best internet. And then we know if the internet's not doing well, most likely it's on the other end, and we can problem solve that. It's easy to get stressed out and feel like we're wasting our clients' time if our internet's not working, or things that can be controlled on our end. It feels like we're wasting our clients' time and money, and we want to be very thoughtful about that. The other thing is to have comfort items with us. See, I have my water with me, or your tea or coffee, glasses if you need them, or those blue glasses that help with glare and eye fatigue, tissues, chapstick, things that are within arm's reach, that you can utilize to have with you. The other thing is to not be afraid to let your clients know if you're struggling hearing them. It can be exhausting sitting there trying to, if they're breaking in and out of, are we lip reading? Are we hearing them? What's going on? Sometimes clients on their phone will put their phone down and it muffles because the speaker is right there. So I've let clients know, I'm having a hard time hearing you. Is your speaker on like a pillow or a table? Oh yeah, let me put in my headphones, and then I can hear them clear as day. But they're not going to know that we can't hear them unless we let them know that. So I think that is something really important, that we again have that back and forth communication with whoever's on the other end of it. So as we're kind of wrapping up with this presentation, I know we went through a lot of information very quickly, but I wanted to give you all as much as you possibly could, in this hour together. But at the end of the day, what we do matters. And I want to leave you with an Instagram post a client sent to me. I want to be very clear. This is not my client. A client sent this post to me. This is, I think she's like a blogger, photographer. And so this is an open Instagram post that resonated with one of my clients, and that she sent it to me and thought it would be really, meaningful. And it was, obviously. So I'd love you to just kind of take a moment, maybe even close your eyes and just listen to these words that I read to you. So the post reads, "To us, you are always valuable and essential, but especially over these last 2 months. You have been at your best, and you've taken on the weight of so many of our worlds through a computer screen. Thank you for the countless hours you have spent listening through earbuds to the unearthed trauma this time has dug up. Thank you for virtually holding our hand as we navigate the confusing emotions that isolation brings. Thank you for giving us a space to voice the concerns we have feared would be met with, it could be worse, and instead acknowledge our struggle as real. Thank you for validating our feelings, our concerns, our trauma, and our worry with your relentless compassion, and challenging us to relentlessly use our tools you have helped us gain. Thank you for allowing us to set aside our emotional and physical filters during the hour we have together, and giving us the courage to step out more authentically outside of our time too. Thank you for being on the front lines of the mental health effects of this time of history. And thank you for all the work that's yet to come. You are appreciated. And I think in all of this work that we do, it is really important to remember that our clients need us. We are going through this pandemic too. I think this is probably one of the first times in history that we are mirroring our clients' experiences. And so we need to make sure that we take care of ourselves and do what we need to do, but our clients are glad we're there. So I am going to end here, stop share, and if you have any questions, please make sure you put them in the little question portion, and Emily is going to help us go through that.
Yep, I've got some questions for you here already, Stephanie. Let's see. First, we have, where can we look for the laws and statutes that you talked about?
So DOPL will have, for our current, licensing, So Doppel will have that, and then the licensing board of wherever else you are wanting to do therapy. So you'll have to check on both of those places, but Doppel is the place to start for Utah licensing. And then in terms of insurance payment, the insurance provider, on the back of the card, I would just give them a call and they'll be able to help you know if these services are paid for.
Awesome. Another question. Someone would love to hear more examples of ways to keep young kids engaged during a session.
So young ones, and I've worked with quite a few online. I do a lot of interaction in terms of like those games. There's some great games online that, and especially if you have decent internet, there's really not a delay. I had a bowling game that you can ask specific questions that you can type in and plan ahead of time of talking about, how was your week, and then after that they can, bowl by hitting the space bar. So that I would really look into those, even type in online therapy games for kids, and a bunch will come up. Watching a quick video together, I would be very careful not to watch anything lengthy with them, but just a quick clip on, inside out of talking about feelings. The drawing can be very helpful. They even have online sand trays, things that you can build together and make a sand tray or a house. There are things that you could do, stick figures together. It really is just thinking about, what would I do with this client if they were in my office right now? How do I translate that to online? And it's getting comfortable with technology and really just thinking outside of the box. But it's amazing what we can do.
Awesome. We have another question, perhaps one that we've all kind of thought about. After 18 months of online living and working, it seems like we should all have learned most of this. Have we learned this, or did we just get by and now we think that we're good at this?
I think a little bit of both. I think, this, online isn't something that everybody has wanted to do. And I think we are taught from the day one of school that it's all about the relationship and how can we have a relationship through a computer screen, but we can't. And so part of it is unlearning and relearning. I don't think, Martell has been really strong since the day I got hired to have a telehealth course in order to teach these skills, to teach theory online, to practice having mistakes, to practice what happens in real time when our internet, goes bunk. And so I don't think it's been out there in the same way as it is now. And so then we're all forced online without the education and the learning. So that was kind of the point of what I wanted to make in this presentation as well, is going back and saying, okay, these are the things that we need to do moving forward. I'm sure a lot of you have clients that you may still see remotely and you may not have informed consent because we just jumped online. So now's the time to go backwards and say, hey, client, we never did this. We need to make sure that we're covering all our needs and making sure everything is working out.
Awesome. Well, it looks like those are all the questions that have come in so far. We have a few more minutes if anyone else has any other questions. Dean Teasley, you have any questions for Professor Bank?
No, I just want to say thank you for this delightful, thought-provoking, as well as informative presentation. We do know from the pandemic that the use of technology is here to stay. And Stephanie is helping us understand the ways in which we do it and how we can meet and serve client needs. So I just want to thank you again, Professor Banks, for your time and your preparation. And we will see more of you in the future.
Thank you very much.
Thank you. With that, we'll close out if there are no more questions, Emily.
That's it. Thanks, everyone. Have a great afternoon.